There's a number of surgeries that are available, and it's important to figure out which is the right one. One of the key factors for me was using the information that I got at my doctor's office. Here's your lifestyle, here's who you are as a person. Now, this is one we think will be better for you. I had to go to a professional to tell me that. I had done all of this on my own before and never succeeded. And I finally figured out that the only way I was really going to be successful was to go to somebody who does this for a living and who knew the ins and outs and could advise me and give me good advice.
At this point, you'll need to decide which weight loss surgery is right for you. Count on your Wellstar team for advice, but some of the decision may be up to you. Sometimes, if people have health issues or are already taking certain medications, it means there's a certain type of weight loss surgery that would be best for them. Also, it depends on what kind of patient you are. Do you follow medical advice? Are you dedicated to your weight loss goals? Are you ready to be responsible for your own health? That will be factored in too. Let's start by looking at all 4 types of weight loss surgery. Roux-en-Y gastric bypass. A small stomach pouch is created and a piece of bowel is brought up to connect to that new stomach pouch. The excluded part of the stomach remains in the body where digestive juices exit the stomach and enter the small bowel to mix with food further down the tract. How does this make you lose weight? By decreasing stomach size as well as excluding part of the bowel from food, intake becomes limited and not all calories are absorbed. Expect 60 to 80% of excess weight to be lost with this surgery tool. Vertical sleeve gastrectomy. With the vertical sleeve gastrectomy, about 4/5 of the stomach is removed, leaving a small sleeve pouch for food. This limits the amount of food you can take in and still allows digestive juices to flow normally. Removal of the stomach results in a decrease of hunger hormones, which means you eat less, so you should lose more than 50% of excess weight with this surgery tool. Pancreatic diversion with duodenal switch. We call it DS. It begins with a sleeve stomach and rerouting of the bowel. This makes you absorb fewer calories and makes you lose weight. With the DS, expect to lose 60 to 70% of your excess weight. Adjustable gastric band. With the adjustable gastric band, a silicone band is placed around the upper part of the stomach. Then, the band is attached to tubing and a small port that is left in the abdominal wall. This lets the surgeon adjust the band size, which lets you increase or decrease food intake. The adjustable gastric band requires periodic adjustments after surgery. Expect 40 to 50% of excess weight to be lost with this surgery tool. These 4 weight loss surgeries have evolved over the years and are now done with minimally invasive techniques. In most cases, our surgeons can perform laparoscopic surgery, making small incisions and using small instruments, so we rarely have to perform open surgery. All surgeries have some risk, and weight loss surgery is no different. Occasionally, patients get blood clots, lung issues, infections, stomach or bowel leaks, blood loss, nausea and vomiting, dehydration, vitamin deficiency, hair loss, heart problems, hernias, bowel obstruction, malnutrition, and other complications, including rare cases of death. Just make sure you tell your surgeon if you've already had some kind of bypass surgery in the past. Your lifestyle is about to completely change, so it's important to have a good support system or a care partner to help motivate you. For the first several months, you'll need to take extra protein supplements, and you'll need to take vitamin and calcium supplements for the rest of your life. Be sure to keep this in mind when you're calculating your after-surgery expenses. You'll need to eat 5 to 6 healthy, very small meals a day, and make sure you don't get dehydrated by sipping on fluids between meals. For best results, you need to stay away from carbonation, caffeine, sugar, alcohol, and simple carbohydrates. Finally, you'll need to develop a regular exercise program to keep your weight loss progressing. Moving forward, your weight loss surgery provider will discuss all your health issues and work with you to find the surgery that best fits your needs and lifestyle.